The word myopathy is the medical term we use to describe a problem that's going on with the muscles. Myopathy can come in a lot of different flavors. In dermatomyositis, we're actually worried about myopathy caused by myositis, which is a medical term that means that there's inflammation of the muscles. So oftentimes patients may hear us talk about proximal muscle weakness, and what we're talking about is the pattern of muscle involvement that we tend to see with patients with dermatomyositis. The proximal muscles are the muscles of the shoulder and the hip girdle. So the muscles we're talking about include the deltoids, the biceps, the triceps, the thigh muscles, and the gluteal muscles, or the butt muscles. When we think about lab tests that are helpful markers of muscle inflammation, one of the most common is creatine kinase. You may also hear us refer to it as CK or CPK. With creatine kinase, the muscles, when they break down, release an enzyme that goes into your bloodstream, and we can measure that in the lab. It's important to realize that there's no such thing as a normal creatine kinase. While we have a reference range, a particular person's creatine kinase depends on their muscle mass, their age, their ethnicity, and their kidney clearance levels. Dysphagia is another important medical term in dermatomyositis. In dermatomyositis, some patients can get inflammation and weakness of some of the muscles that are involved in swallowing. With dysphagia, it's an important feature that we look at, partially because it's an important part of patients' quality of life, and also because sometimes it helps us guide treatment options. Muscle biopsy simply refers to taking a sample of muscle tissue to look at underneath a microscope. And we do this in dermatomyositis for a couple of different reasons. In some patients, muscle biopsies are helpful to both confirm the diagnosis as well as to give us a sense in terms of how much inflammation there is and how much damage to the muscle there could be. It's also important in some patients to end up getting a muscle biopsy to look for mimics that can cause things that look like dermatomyositis but can be slightly different, or to see if there's more than one thing that's going on. One question is whether or not you need a muscle biopsy, and that really depends on the situation. In some patients, muscle biopsies can be really helpful, but sometimes we can make the diagnosis without the muscle biopsy. It's really important to talk with your care team to decide whether or not you need a muscle biopsy and what other testing might be helpful for you in your particular situation.